How you doing, Miss Jones?
I'm doing well. I'm ready to go home.
Good. I'm glad you're ready to go home. My name is Clark.
Nice to meet you, Clark.
I'm one of the nurse practitioners. You're working with the cardiologist, okay?
Okay.
So I just wanted to go over what we've done, what your whole treatment plan is like, and so we're on the same page.
Okay.
All right? So, do you understand what happened to you?
Not really.
Yeah, so pretty much what happened was that, you came in, you remember what happened, you were driving with your husband to see your son, I heard, and you started having weakness in your arm. When you came in, we did a little bit of studies, and initially we thought it was something called transischemic attack, and after we ran more tests, we found out that you had something called atrial fibrillation.
Right.
So pretty much what it means is that your heart has some irregular beats. It's not working the way it should be because the electricity is not as proper as it should be.
And that sounds bad, right?
Yeah, I mean, it happens. Different reason causes it to happen. So there are other things that has an effect on that. All right? But pretty much what happens is the electrical activity is not going in the sequence it should be going in.
Okay.
All right? So there are a couple of things that happen with this. Sometimes we have these things and chaotic, activity compromise our heart. So our heart does not function the way it should, so it can lead to other complications.
Okay.
So you might have something called stroke, which is the bigger picture, but the one you have was the small stroke.
Okay.
So it was good that we caught it for, on time to prevent that. Other thing you could have is called congestive heart failure.
Okay.
That could happen as well. Okay, those are some of the complications. All right. So when you were here, we did a couple of studies just to make sure we were on the same page with what's going on to diagnose you properly.
Okay.
So we had an electrocardiogram done, and pretty much it shows that it shows the irregular heart rhythms. And then sometimes what happens is when you have that done, there is something missing. It's almost like a P waves are missing on your heart. So normally when the heart beats, it should go up and down, and then comes back. You see right here?
Yeah.
There should be another little elevation, but it's missing. So this is what tells us that you have atrial fibrillation.
I understand.
Okay? And we do something called echocardiogram. What it does is look at the structure of your heart just to make sure there is no other structural problems.
Okay.
We also had a CAT scan done of your head, and it showed that you had a little bit of blockage or so in the vessels in your brain, so it causes you to have these weakness, ischemia because of poor perfusion. Okay. Remember, when your heart is not working well, it cannot put your blood.
Is that why I felt dizzy?
That's why you felt dizzy.
Okay.
Okay. So the goal for what we wanted to do was three things, just to make sure we control your rate of your heart, control the rhythm so it's not like it beat once, it don't beat again, and then a few seconds it beat. The third thing is just to make sure you don't have any blood clots. Okay. Because when your heart, the way it works, you could end up with blood clots or thromboembolism. All right. If the medication, we're going to start you on 3 meds. One is your potassium channel blocker, the other one is your calcium channel blocker, and the other one is your anticoagulant, just to make sure you're okay when you go home. But if those medicines don't work, there are other things that the cardiologists or the surgeons can do. Pretty much one is called catheter ablation. They go in and the tissue from your heart that's causing you to have irregular heart rhythm, and that affects the electricity. The other one is your pacemaker, which controls your normal heart rhythm. It sets your heart rate at a certain limit and kind of prevents you from having more problems. The other thing we could also do is called cardioversion or defibrillation. You could shock the heart, stop your heart, and then restart your heart to prevent you so that the heart can start to function the way it should be normally. All right? So I already talked about all the three things that I think this is the plan. When you go home, I see you have your Holter monitor on, and you're going to go home and use that for 3 weeks. But the nurse is going to come in and talk about what your meds are and go into details.
Okay,
Any questions?
No. No.
Okay. So nice meeting you. Take care.
Okay.
I wish you the best of luck. Okay.
All right. Thank you.
And don't forget to call us when you get home with any problems.
All right. Thank you.
All right. Take care now.
Come in.
Hi there, Miss Jones. How you feeling today?
I'm feeling good. I'm ready to go home.
Oh, I hear that. Right, so I'm going to give you a copy of your discharge papers. I'm going to do a quick assessment. I'm going to answer any questions that you might have.
Okay.
I'm just going to listen to your heart. Sounds great. It looks great. Alright. Don't feel like I'm neglecting you. I'm going to be charting as I talk. So I saw that the nurse practitioner came in before I came in.
Mm-hmm.
Did he talk to you about your condition?
He did.
Do you understand what's going on?
Dios mío, no, I'm so confused.
Okay, I'm going to try my very best to explain everything to you, okay?
Okay.
So what you have is a condition called atrial fibrillation. Do you have an idea of what that is?
I have some idea. It doesn't beat properly.
Yeah, so basically your heart has like an irregular heartbeat. And normally that can lead to other things, which we don't want. AFib can have some symptoms. So some symptoms that you might have had or might still have are you might have like palpitations or rapid heartbeat. You can feel like some thumping in your chest or like some pressure or chest pain. It's possible you might feel dizzy. It's possible you might feel confused at times. It's possible you might be very tired, feel weak and fatigued. It's possible you might have some dyspnea or I should say shortness of breath. Okay.
I had all those things.
Wow, I'm sorry that happened to you.
Thank you.
So, some risk factors that could have been a reason why you have your condition now, some things that put you at risk for AFib include being obese, if you have a history of it in your family, if you have sleep apnea, COPD, or any lung diseases, if you've been using certain drugs such as cocaine, that can put you at risk too. If you have a thyroid disease, that can put you at risk. If you have like excessive alcohol use, that can also put you at risk. Smoking can put you at risk, and hypertension can put you at risk. And if you've had any like prior heart diseases, that can also put you at risk.
So I have a few of those things.
Let's see. Ms. Jones, do you have any questions for me?
So what if I don't have any symptoms? Because I read on the internet that if I have no symptoms, I could still be at risk for a stroke. Is that true?
You could be asymptomatic, and normally that's why when you come in, they diagnose you and do the test to find out what's really going on.
Okay.
So your doctor is discharging you to go home with some medications, your two
Okay.
medications. You're going to be going home on amiodarone, which basically this medication is going to help keep your heartbeat, like the pattern of it is going to help keep it normal. You're going to be taking 200 milligrams of amiodarone, and you're going to be taking it by mouth 3 times a day for 3 weeks.
So that's for the heart rhythm?
Yes, that's for the pattern of your rhythm. It's going
Okay.
to help make it more normal.
Okay.
You'll also be going home on cardizem. Cardizem is going to work to help lower your heart rate.
Okay.
So you're going to take 120 milligrams of this medication by mouth. You're going to take it in the morning daily.
Okay.
You also go home on Eliquis. Eliquis is given to help you reduce your risk of blood clot. Now, I heard you had a TIA, which is like a mini stroke from like blood clots forming. That can sometimes happen when you have AFib.
Okay.
I'm sorry, it's just not probably Dr. Coleman. I'll get back to him later. So normally a stroke can happen from AFib because you know your heart is not beating irregularly, so the blood is not getting where it's supposed to go, then it pulls and it causes a blood clot, and that can lead to a stroke. So the Eliquis is going to help prevent clots from
I
forming,
understand.
so you don't have a stroke.
So these 3 medicines are additional to my other medicines. They're new, correct?
Yes, they're new. You have not seen them before. They're new medications that
Okay.
you'll be going on. So you'll also be going home with a Holter monitor.
Okay.
This is going to monitor your heart and make sure everything is going correctly for you. You're going to keep this on and do all your regular activities. Don't change anything. The only time you'll have to take this off is when you're taking a shower. So you'll be taking this home with you. We're going to place the leads and do regular activities, chart it down, and only time you take it off is when you're taking a shower.
And how long am I going to have this?
You're going to have this for 3 weeks. You're going to be on it for 3 weeks.
Okay.
Right.
Sounds good.
Ms. Jones, do you have any more questions for me?
I don't think so.
All right, great. I know I threw a lot of information at you, but the case management and home nurses are going to come to you and explain things into further details.
Good.
All right.
And hopefully my son can be there so he can understand as well.
That would be perfect. I wish you all the best. Good luck.
All right.
All right. Take
Thank
care of
you.
yourself.
Come in.
Hi, Miss Jones.
Hello.
My name is Aisha from Moravia Home Care, and this is my partner, Ophelia.
Hi, Ophelia.
Hi. How are you, Miss
Good.
Jones?
Hi, Aisha.
How you
Nice to meet
feeling?
you. I'm feeling better, thank you.
I understand you just came from the ER.
Yes.
So how was it? How you feeling?
I'm feeling better now.
Mm-hmm.
I had a little episode while I was driving. They called it a TIA.
Mm-hmm.
And then they did some tests and said that was from the Afib.
Afib.
Right. So
Right.
they gave me this Holter monitor
Okay, I see that.
and some medications, and that's what I've been doing for a
Did you
few
get any
days.
discharge paper
I
from
did.
the hospital? Can I
Yes.
take a look at it? Okay, thank
How you guys doing?
I'm gonna do that.
This is
Hi.
my son Zach.
Hi,
Hey,
Zach.
Zach.
I was in the room and I heard you guys, so thanks for coming. I mean,
Oh.
we need some help with just understanding some of the things.
Oh, sure. We're here to help go over her medications and help with anything you guys need help with. Okay.
Miss Jones, I'm gonna just check your blood pressure,
Okay.
temperature, and all the good stuff, right?
Okay.
Okay. Alright. Let me take your temperature real quick. Good. I'm gonna listen to your heart and your lungs, okay? It's a
Mhm.
little cold. Take a deep breath for me, in and out. Okay, I'm gonna listen to your back. Deep breath in. Good.
How was everything? Good?
Oh yeah, everything looks good. Everything looks good.
Okay, I see that they put you on 3 new medications.
Yes.
You have amiodarone and cardizem and Eliquis.
Yes.
So have you been taking your medication?
Yes, I have.
Let's talk about your amiodarone. How have you been taking it?
That one is 3 times a day, right,
Mhm.
Zach?
Yeah, she takes in the morning, in the afternoon, and in the evening.
And where is the medication? Is it one of these box?
I put them all in the box
In this
so I
box?
don't make
Okay.
mistakes.
Okay, while doing that, going over your medication, I'm going to make
Okay.
sure that it's the same order inside here and on your medication order.
Okay.
I see you have to take it 200 mg 3 times a day for just 3 weeks.
Correct.
Yes.
Okay, have you experienced any side effects with this medication?
None yet.
Okay, and just to tell you, let you know the side effect, you have to watch out for like bradycardia and hypotension. This medication helps with your rhythm control for your Afib.
Okay.
And you have to avoid alcohol while taking this medication.
Okay.
And also other herbs. And let's talk about your cardizem.
Okay.
So how do you take your cardizem?
That one is 1 time a day in
One
the
time.
morning.
You take it in the morning,
Mhm.
good. And I see it's other 120 mg PO daily.
Mm-hmm.
And have you experienced side effects with this medication?
None yet.
Okay. And with this medication, you have to avoid grapefruit juice.
Okay. That's okay. I don't like grapefruit juice.
And also, what we're going to watch out for side effects is drowsiness, headache, weakness, and coughing.
Okay.
And with this medication, since it causes like dizziness, when you get out of your bed, you have to like make sure you sit down a little bit and then go your feet
Okay.
before you're able to get up. Just
So
to
I should get up slowly.
slowly, so
Okay.
to reduce your risk of falling or
Okay.
any hypotension.
Okay.
Oh, okay, so her blood pressure wouldn't drop.
Drop, exactly. And also, while taking this medication, you have to you have to avoid the use of alcohol again.
Okay.
Oh, that's
Yeah.
that would be a big one for us
Okay.
because she drinks wine and beer.
Oh,
Every day.
every day. Okay, she specialized in more like with food and nutrition wise.
Okay.
In our nursing area, she's gonna go in
Miss
depth with that.
Jones. I was
Next,
just
I'm gonna
looking
talk
through your
about
paper.
the anticoagulants.
Okay.
Your blood thinner. So can you tell me how you take that medication?
Blood thinner I take twice a day, once in the morning and once at night.
Okay, have you experienced any side effects with this medication?
No.
So one question. I mean, my friend dad used to take blood thinner. He was on one of the medicine. They used to check his blood. Since she came home, nobody has asked her about checking his blood.
Oh yeah, this medication Eliquis, you don't need to like do your blood work.
wow, that's
yeah,
good.
it's not like the warfarin. The warfarin where you need to check your
Oh
INR
yeah, I
and
remember. That's
PTR.
what my friend said. His
Yeah.
dad was on.
With
warfarin.
Eliquis, you just have to take it
Okay.
and it's fine. Just that we just have to watch out for bleeding. Have you experienced any bleeding? Like
No,
in
not
your stool,
yet.
in your
Not
urine, vomit? And okay, if you experience any bleeding in any part of your body, let me know.
Okay.
Or you can call.
Before I left the hospital, the nurse told me that I need to check my heart rate. Can you go over how I should do that?
Oh yeah, definitely. Your cardiac. If your blood pressure is lower than 50,
Okay.
Is it the blood pressure or the heart rate?
the heart rate,
Oh, okay.
the heart
Okay.
rate. If your heart rate is lower than 50, you shouldn't
Okay.
take that medication. And you know how to check your
I'm not
your-
sure. Can you show
Okay,
me?
I will show you how to do that. And since you have your wall clock right here,
Mhm.
you use your finger and feel right here.
Oh, I feel bumpy.
You feel the beep.
Yes.
So you're gonna take your heart rate for full 1 minute.
Okay.
Okay, you're just gonna look at the clock.
Okay. All right, good. I
Got
got
it?
64.
Okay, very good.
All right.
Good. So do
Alright.
Mom, do you understand how to check your heart rate?
I do.
Because I don't want to leave and you call me about your heart rate.
Okay, I understand.
Okay, whenever you're taking this medication, make sure you check your heart rate before you
Okay.
take this cardizem
Okay.
medication. Okay.
And when should I not take the medicine then?
When you shouldn't take this medication when your blood pressure is lower than 50.
When my blood pressure?
I mean your heart rate.
My
is
heart
lower
rate
than
is lower than
50.
50.
That's all
Okay.
Your heart
I
rate.
understand now.
Myself get that mixed up with her too. So
Yes. And also let's talk about your other medication you've been taking. I see you take this is the box of your
Yes,
other medications,
yes.
right?
Those are the ones I took before I went to the
Before you went to the
Yeah.
hospital.
But
Okay,
you're
we just-
gonna teach her about the cardizem. What else? What is there any side effect with that medicine?
Yeah,
with the
but it's the
cardizem?
same with hypertension. You watch out for that when you're getting up in the bed. You have to make sure like you dangle your feet before you get up, and also watch out for drowsiness, headache, weakness,
Okay.
cough,
Okay.
all of that, and avoid grapefruit juice.
Yes, that's a big
You
one.
can't take grapefruit juice
Okay.
with this cardizem medication.
I understand.
And my partner here, we're gonna go in depth with that. With you.
Okay.
Alright.
And also, let's talk about your other medication, like your hydrochlorothiazide.
Mhm.
I see it's ordered 12.5 mg PO daily.
Yes,
You've
I'm
been
taking
that?
all the ones that
You take
Yeah, that's her water pill. She takes
Yeah.
that.
your
that's
water
her-
pill,
yeah,
good.
that's
And you
her
make sure you
water
take that
pill.
in the morning so
Yes.
you're able to sleep at night. So
Right.
you can go in the day.
Mhm.
And your lisinopril, that's like your blood pressure medication.
Yes.
Okay. And your metoprolol, you've been
Mhm.
taking that to your blood pressure medication. And your pantoprazole.
Yes,
That's
for
that's
heart.
mom. That's for the heartburn, right?
Yeah.
Yes,
that's for heart.
that's your heartburn. And I noticed too, you're taking Lipitor.
Yes,
That's a cholesterol medicine, right?
that's
Yeah.
right.
Yeah, she's been on that for a very long time.
But with these medications, it's going to interfere with your cardizem.
Oh, that doesn't
What's
sound
gonna
good.
happen?
With this medication, it may have your increased risk of myopathy.
What is myopathy?
Myopathy is the muscle breakdown.
Oh, and that's really bad for her,
It's
right?
really bad.
So what
And
do we do then?
with this, have to call your doctor
Okay.
to make sure. Do you mind if I call the doctor?
No, go ahead.
Yeah,
Oh, you guys are really good. You,
Yeah.
you do that right away.
we have to do that right away because that's
Mom,
not a
you
good
got the
thing.
best nurses.
Yeah. Hi, Dr. Brown. This is Aisha from Home Care Nursing Hub. I'm at Miss Tina's Jones home right now. Yes. I just noticed she's taking Lipitor and cardizem at the same time. Yeah, need to do something about that. Okay. Alright. Alright. Thank you. I'll let her know. Okay, bye-bye. Okay, Miss Jones. With this, he wants you to come in.
Oh, all right.
Yeah.
So can you
so
take
can she
me?
still be taking the other?
For now, you have to hold off on the
All right.
Lipitor.
All right.
Just
I
hold
will do
off on
that.
that and just go ahead and go
Thank
to the
you for
appointment 2
catching
days
that.
from now. Oh yeah, definitely.
So when are we going in?
He said 2 days.
Okay. So
Yeah,
that's
on
okay.
Wednesday.
Okay.
Yeah,
I'll check my
you can come in
I'll check my schedule.
and you can go with her, right?
Yeah, I always go with her to her
Okay, then
appointment.
that's good.
Yeah, I should be able to make it. My schedule's open.
Okay, and my partner here gonna help educate you more about lifestyle.
All right.
With your new
Thank you so much,
medications.
Aisha.
Oh, sure.
Miss
So,
Jones.
just
Yes.
one thing before we move on.
Oh,
with,
sure.
the, with the Ella quiz, can she shave with like regular shaving stick?
No, you have to use electric razor with
Okay,
that.
so I have to buy her that.
You have to buy electric
Oh,
razor with that
okay.
to prevent bleeding. Because you
So
have
with the heart monitor, what are we supposed to do? Anything different with this?
with the heart monitor, I understand you have to keep it up for 3 weeks.
3 weeks, that's
According
right.
to your discharge orders.
Mm-hmm.
And also you have to put it on at all time and go by with your day by. The only time you have to take it off is when you're having a shower.
Okay.
So
Yeah.
when are we carrying this when we're done? We're going back to the hot doctor.
Yes.
That's when we carry
Yes,
the machine
that's
back.
when you take it back,
Okay.
yeah. And they don't look at it and tell what's
So you just
happening.
monitor her heart
Monitoring
rate,
your
make
heart
sure
rate.
everything is fine with
Yes.
it. Okay,
definitely.
good. So mom, that's good.
Yeah. All right.
Yeah, Miss Jones.
Yes.
I quite remember, like Aisha says something about your. She asked you if you drink, and your son made a comment.
Yeah,
that
Yes.
it's a big
she
deal.
likes- she
I
likes
like
it?
I like to have a glass of wine or a beer every night with my dinner.
Every night.
Every
Miss
night.
Jones.
Yeah.
Yes.
It's been a
That-
long time.
Is that bad?
Yeah.
Oh, why?
Now it's gonna interfere with what is going on with you right now.
Really?
So we have to find a way
Okay.
to stop it.
Okay.
I know it's a bit unfortunate. You've been doing it for a long time. You are
Yes.
used to it. You enjoy it, but we have to stop.
Why
it
is
for
it
the
bad?
meantime.
Because it doesn't
It
interfere?
will increase your heart rate,
Okay.
and it's gonna let your Afib
Okay.
come up again.
Oh, okay.
So we have to stop it.
Okay. Well, maybe I can slow it down.
Yes,
Okay.
we're gonna start by decreasing it. If you, how many glasses of wine do you drink every
One
night?
or two.
1 or 2.
Yeah.
Oh, okay.
So mom, we gotta stop buying the wine. I'll take the
Yes.
wines away. And
Yes,
Okay.
please.
Okay.
Yeah, I know it's hard.
It is.
Yeah, but let's just kind of
Work on that.
work on that.
Okay. Mhm.
All right. And what is your diet like? What do you eat on daily
Well,
basis?
it's not very good. I like to eat a lot of canned soups, and when my son is not here, I have TV dinners, and I was told those are high in salt.
Oh,
And
okay.
she eats a lot of fried food too.
Fried
so,
foods in our culture.
Oh, okay. Now we have to decrease the intake of the fried foods.
Okay.
And also your sodium.
Okay.
Because the maximum sodium intake for a day is like 2,000 milligrams.
Okay, and
And
how
you
do I
have to
know that?
stop. When you buy like anything from the store, like the
Mhm.
canned foods,
Yeah.
just read the labels
Okay.
and the amount per serving.
Okay,
You will see that at least one canned soup can have about 2,000
just one
milligrams
can.
of sodium.
So we
Okay.
should stop the canned soup.
Yeah, you have to stop the canned soup and just prepare something for yourself.
Okay.
So Zach, you're gonna have to
I
buy
have-
better food for me,
Mm-hmm.
and I'm gonna have to learn to cook better.
Yes. I
Okay.
think you have a home health aide, do you?
Yes.
Yeah, she can do the cooking for you.
Okay.
And you just pack them in the refrigerator and
Okay.
enjoy it, okay?
Okay.
So we're also gonna get rid of the canned soup and the
Okay.
TV.
I have a question
foods
for
and the
you.
rest. Go ahead.
Many of my friends go to the senior center for
Mhm.
lunch. Is that healthy for me?
It is, because
Okay.
whenever you go to the senior center, everybody doesn't eat the same thing. Some
Okay.
people are on low sodium, some are on low fat and
Okay.
everything. So tell them what you are not supposed to eat, and
Okay.
they will cater according to what you need.
Excellent.
Okay?
All right.
Okay, and what about exercise?
Well, I don't do any right now, but other than walking. But I'd like to join a program at the YMCA called Silver Sneakers.
Mm-hmm.
All my friends go there, and it's
Mhm.
designed for an older person to go.
Okay,
And it's every day for about 30 minutes
okay. That is
During
the
the week.
schedule for the place?
during the week.
Okay. And did the cardiologist say anything about
I
exercising
haven't
when
seen
you
the
were coming?
cardiologist.
You haven't?
No.
Okay.
She goes to the cardiologist when she returns this in 3 weeks.
Okay.
Should I wait until I do that?
No, when you are in the house, you can just get up from the. You can't sit all day. It's not
Okay.
good for your health.
Okay.
So just get up, in and out.
Okay.
Just walk through the living room, in and out. That is also part of exercise.
Okay.
Lift your hands.
So maybe just walk for now, and then when I see
Yes.
the doctor, I'll ask
Mhm.
him about the silver
Mhm.
sneakers.
Ask him about the exercise, how long you can do it,
Okay.
and what type of exercise that you can do. It's not
Okay.
everything that is good for your heart.
Okay, good.
All right?
All right, sounds good.
Okay. And what do you do to release stress? You know, everybody goes through stress.
I like to do needlepoint and
Good.
crossword puzzles,
Good.
and I like to cook.
Oh,
Very
that's
good.
I
Okay.
just want to add,
Go ahead.
I seen there's a place around the corner to do yoga for older folks. Can I register her there?
Yes. Yes,
Okay.
yoga is good for you.
Okay.
Quiet moments and
Okay.
also Zumba.
Oh, okay.
Yeah,
Okay.
women of your age, they go there all the time. And who knows? You make good friends around there.
Okay. I'll ask about the Zumba when I see the cardiologist.
Okay.
Okay.
That is also a good idea.
Yeah. Okay.
All right?
Yes.
Okay.
Do you have people helping you for your ADL?
Well,
I mean, I
Zach's
help,
been
and
helping me, and then the
home
aide.
health day is coming, so they'll be helping when I'm not here.
Okay.
So just one thing I just wanted to ask. I mean, we Hispanics and we have a lot of herbs we use, and she eats a lot of garlic. Is that going to interfere with
That's
any of
gonna
her meds?
interfere with your anticoagulant medication.
Which one is
Eliquis.
it? Which one is
The
it?
Eliquis.
Okay.
You shouldn't
The blood
take-
thinner.
The blood thinner.
Okay.
You shouldn't
So
take
no
garlic,
garlic.
ginger with that medication.
Okay. So
Yeah.
we're gonna have to change our ways then.
Yes.
And any herbals you want to take, you have to call the doctor.
Okay.
Over the counter medication and anything, you have to call the doctor before taking anything.
Okay.
That's good.
And Ms. Jones, do you drink coffee?
No, I do not.
Good for you. That's good.
So what
That's
does
good.
coffee do to the heart?
It increases her heart rate in
Okay,
case she
so we
drinks
don't want
coffee.
anything to get the
Very
heart.
good.
the
We
heart-
don't want
to
anything-
excite the heart.
Very good.
Good.
We don't want anything that will increase her heart rate. And you still smoke?
I do, but I'm trying to work on cutting it out. So I was wondering if you could direct me towards a program or
Mhm.
some type of help, some
Okay.
kind of smoking cessation.
Okay, we can talk to your primary care physician. They
Okay.
have programs that you can get into
Okay.
to help. And
Okay.
also there are some patches that
Yes,
you can put on
that's
that
what
will
I'm
decrease your
interested in.
appetite
Yes.
for
Many of my
tobacco.
friends have used that, and they said it worked well.
Okay.
So,
Okay,
so
that's
the-
That
the
makes
primary-
you happy,
the
right,
primary-
Zach?
Yes, at least she's not, the primary doctor can help us with that. Good,
Yes.
good, good.
Yes.
Okay.
Yes. Good.
So the other thing before I know you guys, we've seen wrapping up, with the med box, the medication box, I do fill the box for her. So I put the ones that say in the morning, in the AM session, the one that evening, is that the right way to do it?
Yes, that's the right way to do
So
it.
the
If-
morning go in the morning section, evening go in. So
The
we use
evening
like,
section.
so we use the gold one for morning,
Right.
and then the pink one for evening.
Yes.
Is that good?
That's
Okay.
really good. And if you have any question with this, you can also call the pharmacy.
But did you looked at it? I see you looking at it. We fill it out right. You think?
Yes, you definitely filled it out right. I was double checking
Good
on all
job.
that. You guys did really
Ms.
well.
Jones, did you have your flu shot?
I did in
You did?
October.
Okay, that's very good. All right.
You
No
guys have any more
coughing and
questions?
anything? All right.
So regular immunization, flu shot will help with
Yes.
preventing other
Yes.
problems.
Very good.
Okay.
Do you guys have any more questions?
No, but thank you so
I
much for
think it was
coming
really
out. I
good
think
you
you
guys
really
came.
helped us.
Yeah, you
We're
really.
glad we're able to help.
You guys are the smartest we've ever had.
Oh, thank
Happy.
you. Thank you.
Thank you.
But in case of anything, just call the primary care
Okay.
physician's
Yeah.
office.
So can,
Alright.
can we call you guys? too?
Yes.
Where's your number?
Our phone number, I wrote it right here. Our
Okay.
phone number is right here.
So you
Okay.
guys have an
Thank
on-call
you.
nurse that can help
Yes.
us with any question.
You can help you with
Yes.
any question and anything.
Alright.
But if it's like an emergency, you can call 911.
Okay. Thank you so much.
Thank you so much. Thanks, Miss John.
All right.